had this Google review the other day that was like, dentist was lazy and just wanted to do the simpler, easier work. And we were like, it's not about doing the most work on a child, it's about doing what is in their best interest. I'm imagining that I'm going to know this patient for the rest of their life or the rest of my life. So I really want to do the best for that patient. Patients really appreciate it. If it takes you a week to get back to them with a couple of good ideas, that's better than just going in blindly.
You have someone who's applied to work at one of your clinics, right? How do you look at their Instagram?
When I get a portfolio, right, 3 cases on that portfolio, and I look at their Instagram, it's the same 3 cases. So I'm like, oh great, you've done 3 cases that you're like proud of. But what I tend to like is the consistency.
What are some other things, like almost if you can engineer the perfect like associate who would apply to your clinic?
Clinical skill is obviously important in my clinics, right? One thing is that they listen.
What is it that makes this portfolio really stand out?
It doesn't need to be loads of cases, a series of photos that go from A to B.
You have an interesting relationship with social media.
Benefit of my social media is building my team.
Managing teams and doing dentistry still. I mean, time gets pretty tight sometimes.
Yes,
right?
mate. Yes, mate. Well, I kind of managed to get here on time today.
That was good.
Yeah. Today we're joined by Dr. George Cheetham, known to 44,000 followers as George the Dentist. A 3-time Best Young Dentist winner, George graduated from Newcastle with distinction before mastering aesthetic restorative dentistry at King's College London and becoming a pioneer in biomimetic dentistry. The man's list of credentials is seriously impressive. His career is a masterclass in growth. At 28, he turned a struggling Wimbledon practice into a specialist powerhouse and later launched the award-winning Fulham Road Dental from scratch in the middle of a pandemic. Beyond the clinic, he's the official emergency dentist for the Wimbledon Championships. By the way, George is one of the UK's most sought-after mentors, known for launching the careers of top-tier young associates. Today, we discuss his journey from dental school to building multiple practices, what he actually looks for when hiring associates, how to make yourself irresistible to top private principals, and the strategies to fast-track your career in those crucial early years. This is essential listening for anyone looking to excel in private dentistry. Let's get into it. George, for the audience who might not know who you are, who are you?
Just a general dentist, man. I've worked in southwest London now, qualified about 16 years ago, I think, which is crazy because time has flown by. And throughout that time, I've done general dentistry, hopefully trying to get better along the way. Done quite a lot of courses along, like master's degrees, stuff like that. And I have built some practices now. And it's just, thank you very much. And yeah, just trying to, I'm not a specialist in anything, just trying to do the best for my patient and just try to do good dentistry.
Yeah, nice. I mean, I've spoken to some of the clinicians that obviously work alongside you. Amin's one of them, who's one of our guests from last season. And so one of the biggest things.
Boy.
Yeah. Well, I mean, he always credits you with the ability for you to lead a team within practice, which is something we'll touch on later. But really, what I want to start with is the beginning for you, right? How dental school was like for yourself, how you went through it, what your experience was like.
Yeah. Dental school I found a bit tough at the beginning. I think that you go into dental school when you choose that you want to do dentistry at 16 years old, right? And really at that stage, you should have probably already thought about it for a couple of years so you can get work experience, because getting into dental school is quite tough now. And I truly believe that a lot of people go into dentistry is not like, they don't really know what they want to do because they're so young, and maybe they're good at like sciences, maybe they've done maths, they're thinking, oh, maybe I'll do like veterinary or medicine or dentistry. So they kind of go into dentistry. My parents, like my dad's a builder, my mum's a nurse, my dad was like, I don't want you working like outside. They work so hard, right? So they want me to have like a profession. They wanted me to go into uni and come out with like a job. So that's why we I wasn't like pushed down that route, but directed. So got into dentistry, started dentistry. But then I think that, back to the question, like the first kind of few years, well, actually probably the whole of uni, you're thinking like, is this for me? Is this career for me? Because you have those days, right, where you're like, I don't know what I'm doing. Am I bad at this? like, I don't know the answers to these things. I actually think that maybe I'm going down a line where I might just, I might not even pass this degree. And so I found the first few years especially tough, like pretty much just scraping by, just getting by the exams, just about passing. When it came to like fourth and fifth year, when it became a lot more clinical, that's where I kind of found my feet a little bit, started to enjoy it a lot more. But like, I remember some days it's tough. Like you go in and you're like, oh, I've got to do like a post crown, and you're like, what the hell do I do? And you just don't trying to take an impression, and you're like, is that good? Like I really don't know. Yeah. So I kind of found it like there were wavering moments where I was like, what the hell am I doing? But I also had a lot of fun. Like I was up in Newcastle for 5 years. I found like such solid mates up there. Dentistry was quite small. There were like 60 or 70 people per year, and most of the years like knew each other. Yes. So we had a lot of fun together, and I had some really solid mates outside of dentistry. And I kind of, towards the end, I worked hard, but I played hard as well. And it was, I had a really fun time at uni.
I think also, wouldn't you say it's a formative experience, right? Struggling, the clinical struggle throughout dental school. But then how did that parallel with the struggles just after dental school? Like when you first went into practice, DFT, for example?
Yeah, I found it like hard because suddenly you go into a job where you're expected to make your own decisions, right? And you're helped with that at uni. Whereas when I remember there were days where I was like driving home from my VT practice, and I had very supportive practitioners there, so it was great. But like I remember this one scenario: a patient came in and they'd like decoronated an upper lateral, and I was like, "What do I do here?" I was like, "Do I do a post crown?"
Coronated is.
I said like that. Just the whole. It just fractured the whole thing. The root was left, right, okay. And I was like, "Do I put a post crown here? Do I root canal it first? Do I like take the tooth out? Do I put a denture in? Do I put a bridge here?" You're just you have a lack of experience to that decision-making process. You don't really know. And then when it also comes to the clinical side of things, you might have done Newcastle was very good. We did a lot of clinical work at uni, right? But, you haven't done that much. So you go out and you're like, I'm trying to do a composite here. I'm trying to put an amalgam in. I'm trying to do a root canal. So again, there are days where I'll be driving home thinking, what the hell? I really don't have, I don't have a clue. You don't
have the confidence behind your decision making. This is the thing.
You don't have the confidence. And also like, I think that as you go through dentistry and become more confident, at the beginning, you'll only really try something if you've been like literally shown or taught it. So you kind of need that very specific scenario. But as you become more experienced and you've seen those scenarios before, you're a lot happier to just try something because the building blocks of how it works. That's exactly it. That's exactly it. And I think that was a big thing for me, because when you become confident to just try something, then that makes a big difference. But you don't really do that unless you've been shown it initially.
And this theme kind of, I think, continues from your time at dental school throughout your career, where you kind of push yourself forward. And I think a lot of the time in dentistry, it's easy to just kind of hold yourself back, be really conservative with your decision making, only do things if you're sure that you can do them. But I think what's quite unique about you and your journey, and probably the reason why you've been able to progress so much over it so quickly and grow so quickly, is because you take that step and you kind of believe in yourself. It's interesting, like you kind of went into DFT having struggled, not having that much, support, and had that whole experience, and then from there you kind of just took off running. So how did that work? What was that shift like?
I think it is a good point, because it's kind of like you need to grow as a clinician, right? But you also need to kind of stick in your lane as well, because you can't just have, like, if you're not that experienced and you have a patient that has a very complicated problem, you're not just going to jump in and start putting veneers on or full mouth rehab or putting loads of trying to put implants in when you haven't really, you don't know how to bond in a composite first, right? So, but you also need to grow as a clinician. So you need to kind of push yourself just outside like your comfort zone, but in an ethical way that you're not doing something rogue on the patient that you're completely inexperienced to do. And this is where like having good mentors, having good people around you helps, going on courses. But then, you know, not everyone is going to be in a job where they do have that. Like, for example, I started in a job straight out of VT where I was doing a day private practice a week, and it was just me there, right? And a hygienist in the other room. So suddenly these patients are coming in and you're like...
It's all on you.
Like, it's all on you, right? And that is quite a quick learning curve because you have to make these decisions. You have to be quite confident with these decisions because patients need to like believe in you as well. And, you know, dentistry is what you start to realize. It's not just about your clinical ability, but it is a show, right? And you have to fill your patient full of faith, and you've got to be on your A game 100% of the time, because you might see, let's take you see 100 patients, right? That patient is only seeing you once, so their one experience with the dentist is that only experience you're having with them. So basically, it just has to be kind of 10 out of 10 the whole time, which is a grind. Your consistency needs to be consistent.
You're kind of like known, I'd say, for your excellence clinically. You're great with patients, but also you kind of have this humility. Do you think that extends to your experience with patients?
Thank you very much. It's very kind. Yeah, look, I think that, so one of my practice partners, Aaron, he was, when we were kind of interviewing someone the other day, and this kind of hit home, he was like, we just hire just like nice people. You just want someone to be like nice. As a practice owner, you start to see it from a slightly different perspective, because you kind of, when a patient comes in, right, the way that I see it is that I'm imagining that I'm going to know this patient for the rest of their life or the rest of my life. So I really want to do the best for that patient, because I'm going to be seeing them like forever. So if I putting a crown on there or an onlay or whatever, when I see him in 6 months, a year, 2 years, 3 years, 5 years, 10 years, I don't want him to look at my work and think that was a bit shit. I want to look at it and be like, actually, I'm happy with that. Because if otherwise, you're going to just, every single patient that comes to the door, you're going to be like, oh, remember I did that bad work, I did that bad work. And you're going to just not enjoy it. So you need to basically try your hardest through the clinical work, knowing you've done your best. Otherwise, you're just not going to want to be recalling these patients. But I've also been in one of my practices now for like literally just after VT, so that's 15, 16 years. So, you know, you get a lot of experience seeing what works over the time. And also just be nice to your patients. Just imagine it's you in the chair and it's like the other way round. You know, it's just try and be a good person, I think.
I think you mentioned something really interesting there, which is that every time almost you see a patient, you reset your perspective, right? It's that I'm seeing this patient for the first time, I'm seeing them for the rest of their life, or I'm imagining myself in the chair of the patient, and then that will then manifest in how you treat that patient or how you're planning for that patient,
for sure.
right? And I think at the same time, a lot of dentists or young dentists might have these expectations or these perspectives when they first see a patient, where it's like, okay, this patient's got like a really tough, it's a really tough treatment to do, right? Or you're looking at it, just isolating the mouth and thinking, okay, I need to treat this tooth. But then at the same time, then they're neglecting certain other things. For example, they might not make the patient feel heard, or they might not treat them in the right. So do you think that's important for a younger dentist to go in with the right mental expectations and the right mental perspective to frame?
Yeah, I mean, it is a really good point, right? And someone, again, when I was kind of interviewing someone once with Aaron, this guy Nigel came in, and great guy, amazing dentist. He said something very important, and he was like, just listen to the patient. If that patient comes in and they say a few things and you kind of already know the problem, right? Don't jump in and diagnose and get in the way of what they're going to say. Just listen. Even if you kind of know the answer before they finish talking, just let them talk, right? Because they feel heard. You know, even if it's talking about their dog, or how they're like a bit depressed or they've got a problem, just like listen. And you know, dentistry goes more than fixing teeth. You are support to these patients. These patients might have lonely lives, they might be sad, they might be depressed, and you're one of the people in their lives that can like make a difference to them. Communication, I mean, we all know communication is important, but it is so important. Like when that patient comes in and they've got a load of problems, it's trying to also communicate those problems in a way that they can understand, but also planning their mouth in a way that is suitable for them. You know, you can get two patients that come in that have got exactly the same problems, yet one treatment plan will be very appropriate for one person and a very different treatment plan will be appropriate for the other, even though they've got the same issues, right? And that becomes down to like economics, their attitude, if they're kind of a reactive or a proactive patient. So trying to understand what that patient wants and change their plan accordingly is really, really important.
And then, of course, obviously you interview a lot of associates, right, for jobs at your practices. Seeing as communication is such an important thing, and a lot of dentists put a lot of effort into building their clinical portfolios, right? My first question would be, how do you screen for that?
Yeah.
My second question is, how would you systemize that across your practices?
Yeah. It's so first point, right? The portfolio is something that is very important to me, and when I put out like on Instagram or whatever, look, I need a general associate, I need like an implantologist, I get a lot of applicants. So if someone sends in a well-managed portfolio, it doesn't need to be like loads and loads of cases, and the cases really don't need to be perfect because no one is the finished product, right, throughout your whole life. A portfolio goes a long way because I can see that that dentist cares enough to be taking photos of their own work and criticizing it, right?
Yes.
And so, you know, in terms of coming out of uni and starting to go on courses, I think photography is just such a essential part. Because if you start, like since I started photographing my work, and really I kind of started doing it for Instagram, really, my work in that short time frame has improved more than it had done for, you know, double the length of time before that. Because you're criticizing your work the whole time and you're seeing it like on a big screen. So the portfolio almost gets you through the door, right, as an associate for like an interview. And like I say, it doesn't have to be perfect, but just show how you're getting from A to B. I don't want to see just like a before and after, but show me, you know, the rubber dam, the caries removal, show me your thought process behind it, right? And then like I usually do a few Zoom interviews with people just to kind of get a bit of the character. And then what I do is I'll meet them at the clinic. And I don't have any like particularly systematic questions that I'd ask, but I just try to do it in like a relaxed environment and just have a chat with the person. Like when like you mentioned Amin was here before, Amin came in and I was looking after like my dog that day, and we just went for a walk in the park. It's just a good way to kind of get a vibe off someone. And you know, not every practice is right for every associate, and I might not be the right practice for every associate. So it's as much as them finding out if it's the right place for them as me finding if that's the right person. So it's portfolio gets you through the door, and then it's just like having a casual chat. There aren't particular set questions that I ask for that, but just try to understand it from the principal's perspective as well. And what is really important is that all of the associates and people and dentists who come and work for me is that they get on with the team as well. And I want them to value the nurses, I want them to value management, I want them to value the receptionists, because they are just as important for that running of the clinic as the dentists are, and dentists do tend to be a bit diva-ish sometimes, but you shouldn't be you should be respecting the nurse as much as a dentist in the clinic.
Yes. And what I'm hearing kind of is a recurring theme, that you're people first. So that comes with yourself, your interactions with your patients, and also the people that you hire. And it's interesting because I think with dentistry, so often we can get sucked into the science and to the clinical work of it. Like, it's so technical and you're working to the millimeter, and you just get really into that side of it and forget that you're dealing with actual people. And arguably that's more important.
Yeah. I was definitely a victim of that. And like the first kind of 5 years, certainly when I was out, it was all like, this clinical work has to be so technically precise that actually that is more important than making sure that the patient this is convenient for the patient or more comfortable for the patient, right? And sometimes actually, it's a lot of it is their experience. It's coming through the practice. It's being well managed. There are sometimes the technical clinical work may need to take a slight knock at the advantage of the patient being comfortable throughout.
Like when that patient comes in with a decoordinated lateral, like
you've got to,
you've got to understand, get into the head of that patient, identify with them, see what happened, see how you can solve their problem, which is they have a gap in their smile.
Yeah, exactly.
Like, that must be so difficult to deal with.
Exactly. Or like, a tooth, random example in my head, a tooth needs cuspal coverage, right? They're going away for like 2 months after. So it's like, actually, maybe I put an onlay on this, but that temp that I put on, however well I put this, I know it's got more chance of coming off. Just prep it for a crown. Put a temp crown on that is going to stay for like 2 months. There's a couple more enamel prisms burnt during the process, but like, it's better than them finding a random dentist abroad, or that's just a small example, but
that's a really good example, actually.
Thank you very much.
Yeah.
But that's that's the vibe, right? You got to make these patient experiences. When they come in, reception's got to treat them, get a drink, get a coffee. It's that makes people calmer, and it makes them go to the dentist and have the treatment that they should be having.
And this is the thing, is like, for us, this is our whole life. Like, dentistry is our whole life. Saving every bit of enamel we can is our whole life.
Yeah.
But for
Minimally
patients,
invasive, right?
minimally invasive.
Yeah.
And it's so important, but like, for other people, they just want to be able to eat and smile and live their life.
You can be so minimally invasive, it's to the detriment of the patient.
That's interesting and controversial.
Yeah. Well, it's like, I used to be, look, we've got to bond everything, composite everything, right? I can do this big composite onlay on here. Okay, another example. So a tooth has like kind of like a cracked tooth syndrome or something, right? Back in the day, I'd be like, look, I'll put a direct composite on here, massive direct composite, just in case it doesn't settle, right? Yeah. And then, as you get more experience, you kind of understand what's going to settle, what's not going to settle. But then the thing is, you'll put that massive direct composite, a few years later, contact points is a little bit off, right? Trapping a little bit of food, composite starts to stain, starts to wear. All right, we'll change it for ceramic now. You cut it, you put the ceramic on, damn, they get a pulpitis, right? Whereas now I'm like, actually, just put the EMATs on at the beginning. Just get it on. It's probably going to settle. Worst case, it doesn't settle. Make a little hole and do the endo. Yeah. Like you can put, and you've put that patient through more ID blocks, more injections. The treatment's gone on for like 3 years instead of something that could be settled in 2 weeks. Yes. Or like, it's composite wears a lot more than ceramic. So it's sometimes you've like got to, crack a few eggs to make an omelette. And
you are notorious. Notorious for wanting to remove third molars.
Now I am. Yeah. Have you got some? Yeah.
I need to come by Fulham.
You know what it is? Again, it's I work with some great surgeons now. Yeah. And I work with some great surgeons who are very good at it. Look, sometimes if you're taking out enough third molars, you're going to get complications. Like if you put enough implants in, an implant's going to fail, right? I see so many problems. We get so many referrals to my clinic now where lower 8s have been left and the 7's got distal caries that you're like, I hate restoring them because they're so tough to do. Yes. Even if like you're the composite guru, Ahmed Tadfi, you know, you're still going to get the odd pulpitis. And it's like, if they'd had their 8s out earlier, like I saw a kid of a dentist this week, and the kid's 21, and the 7, I don't know if it's restorable now. And I'm like, those 8s, just when you work with a good surgeon, again, just a lot of, I'm not saying every 8 needs to come out, but if it's looking a little bit risky, what you learn is that, again, being in practice for so long, if it's starting to get a bit of pericoronitis, it's going to get worse. Just get it out while you're younger, you're healthier, you heal quicker. I'm not saying every 8, right? But I do think the nice guidelines aren't the most ideal guidelines. And when you work with a good surgeon who does it well, just whip them out.
And one of the beautiful things I think about working in practices like yours is you kind of attract people who go for excellence. Like you mentioned Dr. Ahmed Tarfi, who's an incredible, restorative dentist. And then you have Dr. Yusuf, who does your surgical work. So when you have people like this as a part of your team, I mean, it changes the game of your dentistry.
That is exactly it. That is exactly it. And when you have that great implantologist there, or that great orthodontist that's there, you're like, actually, just put an implant in here, because, you know, the success rate is very high. And, you know, I could try and put a post crown in here. It might last a couple of years, but you're going to be in the same chair in a couple of years' time, and that patient will forget every single warning that you've given them, and that tooth has a poor prognosis, however much you try. When you've got a great orthodontist, you'll realise that everyone needs ortho as well. Like the cause of a lot of problems are occlusion, it's like bad bites. But if you don't have that great team around you, you're not going to think that, you're not going to understand the importance of it, right? So much. But when you've got those special dentists around, you end up doing a lot more comprehensive care, because they're good. The dentists are good, and you want to send them to them.
Talk to us a little bit about how the team is set up, and how you, as an associate, as a young dentist, like for me, I'm entering the workforce now. How do I place myself in a practice which has enough opportunity for me to grow, but also people I can learn from? Like, what's the balance there? How do you know what place would be right for you?
Yeah, I guess it's tough, because I think that what I started to do initially was I worked in, like, I think it's good to work in like a couple of practices, yeah. I did actually enjoy working on the NHS, because I thought that it was like an ethical training ground, and because you're getting your speed up, you're kind of learning what decay is, you're trying to learn how to put rubber down on, you're just trying to learn these things, so you get a good volume of actual practice. Because you kind of need to know a little bit what you're doing and have some pretty quality results if you're going to start to be charging patients for it, because I don't think it's really right to be charging for like an onlay and charging decent money for it if you don't know how to bond the thing in the first place, right? So I think that if you can start working in like maybe a private job, like a day a week or something, and then start to transition to private the whole time, I think that you're not going to get every practice right, and the chance of being, you don't know what a practice is going to be like really until you start there. Like the owner could sell you the dream, or you just don't really know. But it's kind of, I guess that I'll be looking out to try to see what treatments are being done there, what clinicians are there, like if they're, you know, if these treatments seem to be good coming out of the practice. Some of these, you know, a lot of practices do these like CPD evenings now, and when practices are trying to get themselves out there, do maybe help the community, do a little bit of teaching. I think you can kind of try to pick up a vibe, but you're not going to get it right every time. And I think if you've been in a practice for a bit of time and you don't think it's going that way, getting out of that practice and finding a different job is probably the best thing to do, because otherwise it's just like you will get stuck in it, and it's like being in like a bad relationship. The longer it goes, it's probably harder to get out of it. So you've kind of got to make your own opportunity sometimes and get yourself out there.
I think also we've mentioned about having good talent, right? About, you know, exceptional clinicians and how they can impact the success of a clinic, but also it's down to leadership, right? It's down to how do you get a clinic to actually run together with all of these star players almost. It's almost like the manager of a football team, for example.
Yeah.
So how have you implemented leadership and also culture within your practices to get them to where they are now?
Most of my clinicians, when I first met them for like interview stage, they just really care about helping people and fixing teeth as well as they can, right? It's funny that you hear the same thing, a lot of them, they're like, I'm not actually kind of doing this for like the money initially, but they just want to do a good job, right? And I believe that if you do a good job, the money will follow, right? And also you're not going to stay in a job if you don't start getting paid well for it eventually. And it becomes about an unselfish nature of all the clinicians that I have. I have had clinicians in the past that have come in like steamrolling, trying to be like the center of attention. It's all about them. They're not thinking about the process with the other dentists, and they haven't lasted, and they've gone, and they've just been a nightmare for the whole practice. And it creates so much, like you can have one clinician that creates 99% of the headaches in a clinic. And it's the clinicians that come in will understand the pathway for the other dentists. It's like you'll get a restorative dentist in that understands actually, you know, the endodontist is probably going to be better at this endo, so I'll send it to the endodontist. Actually, the oral surgeon is going to be better at taking this tooth out, so I'm going to send it to them rather than them trying to do it and messing it up a bit just for the sake of getting some money. And it's also, they have an understanding of that, you know, of that pathway, right? Again, it's not going to be right every time, but it's the dentists they're not like trying to show off. They just want to be part of the team. But, you know, it's not just me who runs my clinics. It's my practice partners. It's my managers, and everyone has their little part. I trust them completely to do what they do because they're doing it better than I can. And hopefully each of you is doing like enough working together that you've got all bases covered. But it also changes as the business grows, as one practice, two practice, three practice, four practice, hopefully 5 practices soon, and a lab. It's you know, your ideas and problems change, and you just need to kind of adapt along the way.
Well, what was that change like for you? Because of course, being a clinician for so long and then going into the business side of things, like what was that change like for you?
Yeah, I haven't really ever had a set plan in my head. You know, people are like 5-year plan or whatever. I've never actually really had that. The reason I got my first practice was because I started a day a week in a private practice in Wimbledon village. I thought, hey, it's quite a nice area. Maybe it'd be nice to own this one day. And it wasn't the slickest running practice. We didn't have specialists, that kind of thing. But I stayed in that practice with the idea, took some sacrifices in there with the idea that it might be quite cool to own it one day. And then one day they came to me, the owners, they were like, look, we're going to sell this practice. Do you want to buy it? And then I bought it with my boss from another practice that I was working in with Aaron. And because Aaron had his own practices already, it was like holding my hand in the process so we could make these decisions together. So having a partner in that made just such a difference to make it so much easier. And yeah, I mean, I guess I was only kind of 28 at the time, but you just kind of you know what, I think if you think too much about it, you probably wouldn't do it. So I kind of just like did it, and it was like, and it was just kind of like little baby steps, right? Running a practice, or if you ever like build a squat practice, for example, you have like a billion things to do. The billion things are not actually like that hard. It's just making sure they're all ticked off. So it could, if you looked at these billion things, you'd be like, oh my God, I just feel like overwhelmed about this. But when you actually start ticking it off, it's just like quite a bit, and you just gotta just be a bit chill about it. Like take the curveballs as they come.
Most opportunities are beyond the horizon. You just take a step and wait for the next thing to come.
There we go. Those are some good words then. When the most anxious I've been was when I was, like an anxious day, I remember, right? It was during COVID. because Ridgeway, my Wimbledon practice, we'd just done an extension, he spent lots of money, it's just started to get really busy, and then boom, you got to shut these. It wasn't a good day for private clinics because you just can't work, you're getting no income, right? But then in terms of opportunities coming in that time, a patient of mine came to me, this guy called Mark Brown, who's my partner now. And I'd always got on with him really well. He was like, the reason he started to become a patient was because he rang my clinic at like 4:30 p.m. on a Friday. And he was like, look, mate, I've got this, like he had an irreversible pulpitis, I can't get seen, it's like agony. Anyway, waited late, nurse waited late, fortunately saw him, accessed this tooth. And anyway, became good friends over the next like 5 years while I sorted his treatment out, right?
I love this story.
And yeah, I think I'd given it, he was like, I've got some ideas. So I gave him my number, and then he like messaged me. He was like, look, come round. I've got some ideas, let's chat it through. So I didn't really know what he was going to come up with. Anyway, we got like discussing, and he had been in private equity, and he got to the age of 43, and he read something that said, if you don't have your own business by 43, you're pretty much never going to have your own business. So he was like that. He'd left private equity because it was a bit like, he's like a really amazing Christian guy that does all the right things and a great man. And I don't know, I think private equity is a little bit cutthroat, it's a bit hectic, and he found himself becoming like a cog in a wheel, but he wanted his own business. And anyway, one thing led to another. We were gonna and he was like, look, let's just buy some practices. But at that time I was gonna throw Ridgeway as my like collateral, my first practice into the pot. And then there was a day where I was there just like, I think I'd had some drinks the night before, like hungover and like anxious. And I was like, shit, I've got to like, if I go this way, I've got to go chuck everything in this pot that I have ever worked for. If we buy a load of practices and it all goes like Pete Tong, I've lost a reputation, I've put a load of people out of a job. But my wife, who wasn't my wife at the time, was like, look, just do it. Yeah. I think you should do it. And I think that was amazing and supportive, completely unselfish from her. And then we just went into partnership together, and things have grown quickly since. But I think on that point, before I forget, I think life is about, one very important thing is finding the right partners, right? And it might be your business, it might be family, not that you can pick your family, or it might be kind of personal, and finding these right partners just completely changes the way you go through life.
Yeah, and on that point as well, I mean, throughout that process and building clinics and managing teams and doing dentistry still, I mean, time gets pretty tight sometimes.
Yes,
right?
mate. Yes, mate.
Yeah.
That's why I kind of managed to get here on time today.
That was good.
Yeah. How do you go about like prioritizing things? Like,
yeah, I mean, look, I do a lot of work, right? And at the moment the idea of like a lot of people's heads about building practices is that you start to kind of cut the clinical time, go into more management, and just like kind of work off a laptop in Bali or whatever. But it's completely the opposite for me. And I do 8 to 5 days a week still, clinical work, right? Really? But that means that, yes, more than you guys probably, right? Yeah. No excuse for us. No. But that means like, while that light curing unit's on, I'm reading an email or doing a WhatsApp or solving a problem, right? Or, you got 5 minutes between a patient, I'm on the phone to my practice manager or my partner, I'm dealing with a curveball that's happened today. And, we have a lot of staff now, and that comes with a lot of admin. So there's a lot to deal with. But again, I have a very understanding wife. I go home, she doesn't mind if I'm on the phone to like people, my practice partners, or someone's ringing me for like, I don't know, a bit of advice or whatever, right? But there's a lot. But I do enjoy being productive. And again, COVID taught me this. When I was kind of sat on my arse at home, not really being able to do much, I was not an enjoyable person to be around, because being productive, I think I've learned, brings me happiness.
Before we move on then, how do you find the right partner?
I think that you've got to kind of you've got to put yourself in enough scenarios. I think people make their own opportunities, right? And I think that you have to go out your way sometimes to put yourself in front of people, to meet enough people, and it might be like a personal, or it might be like professional, right? It's like, for example, say if you came to the practice when we first met or whatever, it's a big thing to go out of your way and have confidence to go and like shadow at a practice. Or when we do our like CPD evenings, for example, I'm like, wow, some of these people have travelled like from Leeds or whatever for a CPD evening. They don't know anyone here. They just rocked up to my clinic at like 7 p.m. to watch a lecture and have some pizza and put themselves out there to speak to like 20 people there. Yeah. You've kind of got to like, and that's, some of these people aren't naturally confident people. So you've got to just get yourself out there. You've got to put yourself. So I met Mark because I helped him out when the practice was closing at 4:30 p.m. I met Aaron, my partner, because his practice, when I started working for him, his practice weren't even advertising, but I just printed a CV, I put some work on a USB, and I just put myself, I was like, have a look at this. And then they're like, all right, come down and have a chat. They're like, we don't have a job at the moment. And then the job happens, right? So I think you've just got to get yourself out there. And if it's like a personal one, just like date loads. Just date loads. Yeah, get your Hinge.
Right. And then I think one thing that you mentioned throughout, right, and it's something I picked up on, was it's this balance between confidence. It's almost like this zone of confidence, because even from the beginning you mentioned, like, if you're not confident enough, almost you're doing an injustice to your patient as well, right? In terms of you need the confidence to do certain things, but then also at the other end of the spectrum, you've got like almost arrogance, right? Where you're overly confident.
Yeah.
What's that zone of growth along that whole spectrum?
Yeah, I mean, it's hard because it's like that classic graph, right? That like you don't know what you don't know, and that's the problem. And a lot of the times now when I'm doing like a case, even if it's like a simple crown, or it's like not that I do much root canal, or if it's like a bigger case, right? I'm trying to see the future problems before they've happened to work out how complex this case is going to be. Like if I need to put like an onlay on something, I'm like, can I isolate this tooth? What's this patient like? Have they got a big gag? Have they got a powerful tongue? Don't they go numb? And that changes the decision process for me. But that kind of takes a bit of experience sometimes. So it's just, try to sick, if you're a general dentist, try to sick on the kind of like single tooth stuff at the beginning, right? Once you become more confident and you know that you can bond something in well predictably, you can get that rubber down when you can use a sectional matrix, try to do two fillings next to each other. Then you start doing quadrants, right? Then you start doing like a couple of arches. Then eventually when you've got enough experience, maybe you're thinking about the full mouth. But again, it's only really in the last 4, 5, 6 years that I start to see a mouth and really thinking about things comprehensively. And this is what I try to talk about my younger associates. It's like, look at that whole mouth, right? Look at that bite. Why if they've got no back teeth, why are you trying to put front like bridges and stuff on? Think about getting up to at least the first molars. Do they need ortho? Do they need their bite changed? Do they need to think about having some implants back there? You need to be thinking about this, because otherwise if you start thinking about just doing some work anteriorly, it's probably going to fail because their like occlusion's not right. I would advise, what made a huge difference to me was getting a scanner. And I got a scanner first in 2017. The reason I got a scanner is because I started doing Invisalign then, right? And I was just like, I tried to take these Invisalign impressions, and it was on my nurse like the second time, a third time, a fourth time. At the end, I was just like fucking throwing this thing out the door, right? I was like, okay, we're buying a scanner, Aaron, right? But when you buy a scanner, when you have that scanner, that patient's mouth on the screen, I don't know what it is, but you just see things in a different way to what you see it in their mouth. And you're looking at the bite, you see things in so much more detail. You see over erupted teeth, you see big overjets, you see big overbites that sometimes it's a bit hard to translate in the mouth. And when you start seeing that, it's you just start to think more comprehensively. You know, when your patient comes in the chair as well, you don't need to know the answers on day one. And again, this is what I try to talk about my younger associates with, right? And I'll be like, you kind of need to know enough to spot, like, look, there's an infection there, there's a hole there, there's some caries, these all need to be dealt with, right? But you don't need to give that plan on day one. Patients really appreciate it when you say to them, we're actually fortunate here. We work in a team of where we have experienced colleagues around me. We've got our gum person, we've got our braces person, we've got our implant person. I'm actually going to speak to them about this, and I'm going to propose a couple of plans for that. And if it takes you a week to get back to them with a couple of good ideas, that's better than just going in blindly straight away and just starting to drill stuff when you haven't thought about what's going to be happening in the future, right? Like if you've got an upper six and it's unopposed and there's nothing on the lower six, should you really be doing a root canal and a crown up there when it's not actually in use? Or should you be talking to that patient saying, well, we can do it, but really if you were doing it, you should be thinking about having an implant down here, right? Or are you just wasting that patient's money by doing that treatment on the top tooth when they don't really know that it's unfunctional, you know?
And it's almost like that humility can serve you and your patient's relationship, and it kind of creates a more trusting environment because they know that you know your limits and that you're looking to find the best solution for them as well, right?
Yeah. And look, saying no when you are at your limits is very important, and I probably do that more than ever now. One, because some stuff is complicated, and two, I get a lot of nut jobs in the chair where you're like, whatever I do, I know your expectations are far too high, and I would prefer to just sleep at night rather than worrying about you. And sometimes I'm just like, look, you can keep the consult fee. I just literally can't help you here because there's someone better than me.
Have you had any of those stories that you can share, maybe?
It's not like I had. You get the odd one. There was one very recently that came in. She was like, she had like all veneers on the top, all veneers on the bottom, like onlays and everything, and they weren't great, to be honest. And she's like, I just want the top ones done. And she's like, I've been to like 5 dentists and 3 said they could do it, 1 said they couldn't do it, right? But I was like, you can't, your bite is really messed up here. You can't just change these top veneers. If you're going to do something, it's all or nothing, right? But they're like, oh, but the other dentist said they could do it because, you know, some dentists see the idea of doing like 10, 12 units as a nice money maker, so they're very quickly to jump in. But you're not seeing the problems before that's happened. And the bite, it's rehab or nothing. But at the end, I was like, I'm not doing that rehab because it's when you've got patients that come in that are a bit hectic and just say no to some people.
It takes a few hurdles, right, to even be able to spot those kinds of scenarios.
And some patients just, you know, especially if they've got more complicated, they will stick with you for months. And from the beginning to the end of that case, you know it's going to be with you for months. And throughout those months, you're going to be worried about that the whole time. And when you go to sleep, you're going to be worried about it, and you're going to be thinking about that temporary. You're going to be thinking about whatever, right? Or when you go away, when you get an email, you're like, that focuses on everything. And also to the point where, like, saying no, when that patient comes in with that broke decoronated tooth, right, when they beg you to put a post crown in it to save it, just for a couple of years, doctor, that's all I expect. Even if you've warned them, in 2 years, if it did fail, they will forget every warning, and it's your fault that that's broken, right? And 2 years goes very quickly. Hopefully nothing fails in 2 years, but you get my drift, right? Yes. It's like that you take it out and you have an implant, or you've got like whatever, right? You know what I mean? Because they will forget all the warnings, and saying no sometimes is a lot more important.
And it's difficult sometimes because it's like as dentists, we have this kind of feeling of obligation towards the patient, right? Yeah, naturally, right? Anyone who goes into dentistry goes into it because they want to help to some extent, right? So it's kind of reconciling that with knowing that in that specific scenario, it's best not to for them, right? How can
Yeah.
you judge this situation?
You are like, sometimes it's like us, it's hard to judge, but it's, if you are strongly thinking it's not the best for the patient and they think it's the best, you've just got to be like, look, I know what these problems can be if we do this, and it is not best for you, and we just can't do it, right? It's like, we get quite a lot of referrals at our clinics for more complicated restorative work, right? But they've like got a bit of perio, their occlusion's messed up, and you're like, we can't put these implants in until this is dealt with. You need to address that perio, you need to have that ortho. There's not much room there for an implant. You know, maybe I could squeeze one in, but it might be just in there. Just be like, you need the ortho. It's the ortho, or you don't have treatment. And they might be a bit disgruntled, and they will go somewhere and they will probably find someone who doesn't do the ortho but puts the implant in, and you know what? They come back to you and it's failed, and you're like, you can't even say I told you so. Yeah. It's really annoying. But you're like, oh, sorry. Like, do you want the ortho now? No. You're like, all right, yeah, there's no point you being here.
Well, sometimes you do have those patients where it's like you have the opportunity to reframe them as well in terms of educating them. But at the same time, they might have certain beliefs about their treatment, as you mentioned, maybe not to the extent where they're adamant to the point where you have to turn them away, but where you have to have a difficult conversation to re-educate them on those things. How do you approach that conversation with the patient?
Some people want to listen and some people do not want to listen, right? Hopefully it is a person that they want to listen, and you take it, and you just have to spend a lot of time with them. And you have to take it back to the simple things. You start with like prevention, talk about stabilization, then talk about the more complex care, right? Taking it in those baby steps. And hopefully if you repeat it, they understand. Some people don't want to listen, and they're the people that you don't want to be treating anyway. I'll give you an example. And we had and it's the people who don't want to listen that will complain. We had this like kid that came in recently to one of our clinics and saw a specialist pediatric dentist, right? Specialist pediatric dentist, amazing. If I had kids, 100% they'd be going to see them. Kid came in, and usually it's like, typically I found it, the kid comes in with the mum, kid's got a load of holes, and the mum wants to blame someone. And it's kind of, the kid has kind of been neglected a bit, maybe, or the parents have been a bit uneducated about everything. And the mum might have a particular idea that the kid needs white fillings, or they're just going to get that. And you're like, actually, no, like, these teeth need to come out. You need like a stainless steel crown or whatever. And the mum's like, some of the clinics that we have, patients tend to be of a higher socioeconomic class, and they've been like spoiled their whole lives, right? And then you're trying to tell the mum that actually, look, you need this, but the mum's like, no, but they have a gap there. And that tends to be the ones where the complaints come from. And it'd be like, look, I'm not doing that. And we had this Google review the other day that was like, dentist was lazy and just wanted to do the simpler, easier work. And we were like, we don't usually reply to these Google reviews, right? Because you don't want to get into like an argument. But in the end, I was like, I really want to put a reply here to be like, it's not about doing the most work on a child. It's about doing what is in their best interests. And we will refuse to be put in a corner to do treatment on a child that is not in that best interest. But then the mum's like, well, you know, kicking off because you're not like putting like a bridge in on like a 5-year-old or whatever, right? But my point is that some people don't want to listen, right? But you know what? You do not want those patients in your life, so it's best they go elsewhere. So best take a little bit of punishment for like half an hour to never see that person again.
Yeah, but at least you know within yourself that you're doing the right thing, right, for that patient.
Exactly. And if you did, I tell you what, if you were forced into the corner and you did that treatment that was not in that best interest, when that goes wrong, it's a whole world of different pain from that mum or dad.
Talking to dental students who are in their final couple years of university, they kind of have their bearings on the clinical side of things and they're preparing for post-graduation life. when you take this idea of case selection and patient selection, how would you kind of apply that to dental school? Do you think that you need to design kind of your clinical experience in dental school to be a certain way? Are there things that you feel are easier to learn in dental school, and there are things that are easy to learn on your own? Do you know what I mean?
I mean, I don't know, dentist school's probably a bit different now because I started there like
Yeah, I guess it was a while ago.
3 right? So we kind of got what we were given, right? You kind of look for patients. If they need an endo, you do an endo. If they need a bit more work, you do it that, right? I think you can worry a bit. A lot of what I seem to see now is I get a lot of messages, Instagram especially, where it's got like people in like dental school. They're like, what can I do to get myself ahead? What courses do I need to do? What do I need to do that? And I'm like, look, chill. Just have fun, right? You're not going to have this opportunity to have not that many responsibilities again in your life. Just enjoy. Like dental school, you're not going to get that much clinical experience, right? And the time goes so quickly. Live with your mates if you can. If you're living at home, spend a lot of time with your mates. Go out, have fun, have dinner with them, and just have fun at uni. I didn't do anything in dental school to try to like push myself ahead, but I get now with like social media and stuff, people become like, there's this hysteria about everything. Everyone's looking at what everyone else is doing, so they kind of want to try to match or get ahead, and it's like, just that the years go quickly. Just enjoy your time at school. So I don't know what it's like now, but I don't think you would be able to manipulate university that much to change that like experience. Try to get involved with the experience you can.
You have an interesting relationship with social media. Tell us a little bit about that, kind of how it started off, how it's affecting your career now.
Yeah, this was another like Aaron thing, right? A lot of the things in my life I have to pay credit to Aaron, my practice partner at Fulham Road Dental, and soon to be another one hopefully. He was like, I remember vividly, I had a car back then, I don't have a car now, and I remember driving in my car, I was obviously on hands-free, right? And he was like, look, you need to start, we were looking at building the practice at the time and trying to expand it. So he was like, you need to have a social media, because I'd started doing Invisalign at the time. He was like, you need to have a social media to like get your cases up there, it's going to get patients in. So I was like, all right, what do I call myself? And he was like, you're a dentist, you're George, so George the dentist? I was like, sweet, let's do it, right? And it just came in there, right? And social media began with me aimed at trying to get patients through the door. So it'd be like before and after pretty pictures of like composite bonding or Invisalign or whatever, what does the patient want to see? But very quickly, I realised that I found that personally a bit boring, and I didn't actually really enjoy doing it. What I kind of enjoyed doing more was just kind of posting more the nitty gritty of how do I get from A to B? Like, how do I do that deep filling? What if the gum's overgrown? How do I like isolate it, right? And some of the people that I was seeing on Instagram at the time, like this guy called Omar from Dubai, he was putting all these cases up. And I was just like on his stories, right? He would do a story, like 20 pictures on his stories. How does he get from that to that? And I was like, oh my God, this is amazing. I'm just learning so much throughout the process. And because I started taking a lot more photos at the time, that's kind of the route that I started going down. And I found that I tended to get a lot more dentists starting to add me rather than patients. And you know what? That's what I enjoyed. So it's just what I started to do. And what it's helped me a lot with now, and the benefit of my social media, is building my team. And I don't really do it to get patients. I do get a decent amount of patients through the door because of it. But for me, it helps with recruitment, because I tend to share what not I'm doing in my clinic, but what the other clinicians are. So then if I'm like, look, I need a periodontist, I will have quite a big audience of dentists. So there might be a periodontist looking that needs or wants a job in Southwest London and wants to work in the team with our great orthodontists, with our great implantologists. So in terms of recruitment wise, that's probably one of the biggest things. I think it helps me because, you know, the clinicians that see your work and want to work with you will probably have a similar sort of values as you do. So you tend to find the right people that way.
And how do you use, for example, if you have someone who's applied to work at one of your clinics, right? How do you look at their Instagram? Do you look at their Instagram and what are you hoping to see?
Yeah, I do. It's you will tend to, when I get a portfolio, right, sometimes I might see like 3 cases on that portfolio and I look at their Instagram and it's the same 3 cases. So I'm like, oh great, you've done 3 cases that you're like proud of. But what I tend to like is the consistency. So if someone is out there and they are just trying to get themselves out there, they're posting their work quite a bit, even if it's not the best work in the world, you know that they're trying like really hard and they're being actually consistent with their work and they're doing a lot of it. So I tend to quite like that, really. I tend to like the kind of clinical stuff rather than the like bathroom selfies.
I think also, I think this applies more to perfectionists, but I think also there's a big parallel between being a perfectionist and being a dentist a lot of time with young dentists, which is that it's this focus on showcasing perfection,
Yeah.
right?
Yeah.
Rather than like knowing you're perfect, but also fearing putting yourself out there
Yeah.
because you want to be perceived as perfect.
Yeah.
Do you see that a lot? And
Yeah. It's a great point. And like one example of that, my implantologist, one of my implantologists, Ernest, he does the most. I don't know if you need to follow him, you need to see his work. His work is incredible. Like he's been in 6 countries this last week. I'm trying to ring him about cases. He's like, I'm in China, mate. I'm in Jordan, mate. I'm here. I'm on a fucking plane or whatever. I'm like, what the hell? Because he does all this auto transplantation. His implant work is impeccable. And I'm seeing him and I'm like, post that on Instagram. He's like, no, it's not good enough. In this like sexy Spanish accent, right? And I'm like, Ernest, look at that. And he has that. And I'm like, mate, just get yourself out there. Stop like being an idiot, right? And that's someone who but again, some people message me and they're like thinking about starting an Instagram. And I'm like, just start posting it. Don't worry about what people are going to say. You are going to have so much more self-development. You are going to grow so much more as a clinician if you start posting more, because you're actually going to photograph your work and you're going to critique it and you're going to get it out there. It doesn't need to be perfect. Like I post a lot of work that is really not perfect and I see something, I'm like, I can get better next time. You're going to get the odd comment from someone that's like, oh, look at that gap. Or whatever, right? But I'm like, what? You just kind of, whatever, it doesn't matter, right? Better than Facebook anyway. Facebook, you've got someone being like, you're stupid. Yeah, look at you.
I think because I think what people overlook is they look at, okay, I'm posting a case. The case should be good. But like you mentioned before, it's more, what does that tell the person who's watching about you, right? It's that you can self-reflect, is that you've got the confidence to put yourself out there as well, and you're constantly improving through the consistency of your cases. I think that's also one thing I'm guessing from your perspective as someone who is looking for good talent, that's kind of a green flag for you. What are some other things, like almost if you can engineer the perfect like associate who would apply to your clinic, what are those things that you're looking for?
So clinical skill is obviously important in my clinics, right? Not expecting perfection. One thing is that they listen. And, you know, if I can have a dentist that comes in, I try to get my dentists when they're seeing new patients, right, especially when they're kind of starting, decent set, you can do a lot on the cloud now, right? So I'm like, take a digital scan or a good set of photos, take a good set of x-rays, and let's chat about it tonight. So if you see like one new patient, I can just log in to see these scans and I'll just have like a quick chat about it, because I will probably give things a bit of a different perspective than someone who hasn't been doing dentistry for so long. And it might be like, actually, maybe we need to think about filling those gaps at some point, but they need ortho first. And they've been like, oh, I was just looking at like the broken teeth, right? And someone who doesn't take like offense, because again, I don't have a lot of time. So I much prefer to talk very directly to someone for like 5 or 10 minutes without them taking offense, being like, oh no, I did it because of this. I'm like, I don't care. I'm not saying you've done, I'm not going to critique you or tell you you've done something wrong, right? I'm here to try to help. So let's have that open discussion quickly and you're going to grow, and that's amazing. So someone who will ask me questions and they're willing to listen to the answers and they're willing to change their approach taking my advice. I don't always get everything right. I'm not saying that, but we will like grow together. That's the thing. Someone who just works well as part of the team. They're not trying to be that superstar. They're not trying to do that endo. They're not trying to do that extraction. If there's someone that is slightly outside their comfort zone, someone who treats their patients with respect, someone who treats patients nicely and treats them like they're their family, but also treats support staff, nursing, management well as well, and yeah, someone who has a bit of fun along the way.
Nice. And then moving to the portfolio, because we kind of touched upon it right at the start, right? What is it that makes this portfolio really stand out?
I like, you know, who sent me a great portfolio? I don't expect people to do this at all because it was like an A-star portfolio. Was Dr. Vic. So Victor, right? You know Victor. His portfolio was stunning, but he has got a natural flair, not just for like photography. He's got great clinical skill, but like his presentation style. And his portfolio came in as keynotes, like things flying up there. He'd changed like the wording to like a maroon color to like secretly manipulate me because I wore maroon scrubs that I didn't even realize that he like admitted later, right? But it doesn't need to be loads of cases. A series of photos that go from A to B. When I see a tooth with a big amalgam, then I see a crown on it after, all I can judge from that is if the lab's a good lab, right? And they've made it look a bit pretty. I want to see maybe with the rubber dam on, with the crown off, cleared the caries, the core in there, you know, the scan or the prep or something. If you're doing like an MO or a DO, I don't want to see an amalgam and a composite. Again, I want to see maybe the rubber dam on there. I want to see the caries removal. I want to see the sectional band in there, right? Again, it doesn't have to be perfect. If I can see that process, right? And then when someone sends that to me as an associate, I can be like, use this band instead of that. It'll make your life easier. So seeing that process, just crop the images well, get them all like in the right direction, make it very easy for me to read as well. So like as a kind of presentation, like a keynote or something, if you send me a Google Drive with like 100 things to click on, I'm just not going to do it. I don't have time for that. So how you get from A to B, and also dedicate your portfolio for what I want. If I'm looking for a general dentist, I'm looking for general dentistry. I'm not just looking for before and after Invisalign shots.
Interesting. And almost a common theme, again, throughout almost being a standout associate, right, has been this A to B. It's been like, okay, let me see your process. How well do you do your process when it comes to communication? What's your process in communication? When it comes to showing your work off, I don't want to see your work. I want to see how you've progressed through it, how well you've thought through it.
Yeah.
Same thing when it comes to the CV. It's like, what's your process? Why are you doing certain things?
That's a good point. Yeah, you're absolutely right.
And I think it's also because, and correct me if I'm wrong, it's almost like you're seeing how someone can then think and then how they can go about things independently. Almost as if they're kind of like a ship that just needs nudging in the right direction once in a while.
Yeah, I'm the wind, like go that way a bit. It's a good point because again, no one is the finished product ever. People should want to grow, they should want to get better. You know, I might have a specialist in this, a specialist in that, but they want to learn, they want to get better, they want to, even if they're an endodontist, they want to understand a bit more about the ortho because it might affect their treatment, right? And when you're looking at the process of people and the way that they think, you kind of get an idea about their values and if they are going to grow or they're going to work as part of the team.
I noticed that about you as well. It's like kind of pattern recognition and then how that might predict the future. Not only within people like here recruiting, but also within treatment, right? As you mentioned, like what we're looking and assessing the situation now. How is this going to be in 2 years, 5 years?
Yeah.
And then also in people, right? What are they like now? What are they going to be like in 5 years? If they're coachable, if they're someone who can take on feedback, how can we grow them in 5 years? But if they're not, then they can't grow in 5 years.
Yeah. And you know, you can have that rough diamond that turns into an amazing associate that just is willing to adapt and listen to the things that I have said. It's also your patients, right? If you've got a patient that comes in who doesn't listen about brushing their teeth, their bags full of marshmallows, right? They're not going to stop drinking honey with like 1 billion teas a day. There's no point even doing dentistry on them. There's no point doing crowns. There's no point doing more complicated work. It's just like you've got to kind of just stabilize until they are gonna change, and your plans that you provide for patients should be adapted to that patient and what, you know, if they listen to you as well.
Yeah, and it's almost comforting to know that as well as a young dentist, which is that you don't need to be perfect in the first instance. It's more if you've got your process there and you're working on yourself, and also it's comforting to know that, for example, yourself and other practice owners out there who see that and who are able to operate in that way also see that. I think that's a strong message for young dentists as well. Apart from that, I mean, perhaps speaking to the audience, what are some other, you know, maybe in 60 seconds or a couple of minutes, messages you would like young dentists to know?
Things fail, and you shouldn't beat yourself up too much about it, right? You're going to do a deep filling and it's going to get pulpitis. It's going to need an endo. You haven't done anything wrong there. You're just treating biology. It's not your fault, right? You're going to place a crown and it's going to crack at some point. Patient factors cause dentistry to fail. It's not your lack of clinical skill. Patients go out and they grind their teeth. They don't wear their mouth guard. They don't wear their retainers. They chew on stones. They just do they get punched in the face. They just drink sugar all day long, right? Things fail. Hopefully you get to a point where that failure becomes like quite a small thing, but they do fail, and don't beat yourself up too much about it, really. I think just try to have like fun along the way. We can get so worried about the smallest little thing and the one patient, and I'm a victim of that myself. But when you kind of take a step back, see the broader perspective, you know, we are all actually very lucky to be doing what we are doing. You know, if you're providing dentistry, you're healthy enough to be providing that dentistry. There are a lot of people in this world in situations where that is just not an opportunity for them. So smile at the blue skies, smell the roses, and time goes quickly as well. You know, you're thinking a year at uni, 2 years at uni, suddenly think about dentistry as a long-term thing for the patient. There's no point just stabilizing a mouth and finding in 2 years in the same situation, because time goes so quickly. So try to plan for the long term, and say no to the odd patient.
Nice. And then our last question that we asked all of our guests, which is, what does success look like to you?
I don't know. I mean, what I am enjoying at the moment is growing a business. I am not growing the business because I'm looking at it for a point of, look, I'm going to set out and make X amount of millions or whatever. Like, there are days, I was saying to you the other day, right, where I've had a busy day in clinic, 5 surgeries have been fully booked. I'm like the last one there locking up, and I've just seen all the nurses have a great time together. They might be going out for dinner afterwards. I've seen the clinicians not be limited by the surroundings around them, but they're limited by their own growth thing, right? So providing the environment that people can provide the dentistry they want to provide, and seeing patients walk out the door that I feel have had an amazing experience and great dentistry that they can't get everywhere. But more and more time goes by that I start to appreciate time, and, you know, spending time with loved ones, friends. The things that make me happy, the things that make me smile, it's the simple things. It's like walking my dog, it's seeing my wife, it's having a meal with my parents or my parents-in-law. So it's trying to boost the time to be able to do that and be healthy for it.
Brilliant. George, it's been a pleasure.
Thank you, guys. Thank you. It's a real thank you so much. Cheers, guys.
Great. That was amazing. That was good.
So
You were
good.
amazing. You both were amazing.